Dr. Neil. All right, let's look at this prep. So I'm assuming this is before modification requests. So based on that, before mods, based on that, let's analyze. Gingival clearance is 1 millimeter. That's this space right here. Check. Cable surface margin, slightly irregular, but pretty smooth. That's this whole thing here. Check. Small area of unsupported enamel, which is not necessary for facial aesthetics. You don't have that. That looks good. Now let's look at the axial depth, which is where a lot of people get tripped up. So for maxillary centrals and mandibular cuspids, the depth of the axial wall extends 1.5 millimeters from the DEJ. So it's hard for me to see the DEJ, but if it's around here, then this should be 1.5. Don't go over, okay? But don't leave it at like 1. Really do get to 1.5. So I'm not sure if you're over or if you're right there. Just really measure it. This is an important measurement. So make sure from the DJ, you're getting 1.5. Now, if you get a lateral, then let me switch colors. In case you get a lateral, then the depth is 1 millimeter from the cable surface margin. So then we're measuring from here, and then we're going 1 millimeter. So for the lateral, it's very tiny, and for the central, it feels very big because normally we wouldn't go that far in a normal situation when we're doing a normal prep. So just measure this. I don't know if you're a bit over, but that's the requirement. I think you may be just like spot on. Then finally, no caries remaining, no damage to adjacent teeth, and then the height going this dimension is 3 millimeters. So I believe you have it perfect right here. Boom, boom. 3. Check. So I would say this is at the very maximum levels that you should be, and this is before modification. Now, if you start asking for a modification, let's say there's caries right here. I just want you to take a round burr and remove caries in whatever areas you have. Okay? Then, if you see that you have unsupported enamel, because you removed caries, you have unsupported enamel here and here, then you ask for another modification to remove unsupported enamel. So that's how I think you should do it, is just get step 1, max limits. Step 2, only remove caries with a round burr. Step 3, get another modification for unsupported enamel if needed. So really good job, much better outline than your first one. It's actually a lot bigger than what you would think, but the lateral is much smaller than what you would think. So once you start doing the lateral, you can compare.